The door is closed. Inside, a county planning forum is hashing out a localized nutrition policy. The air is heavy with bureaucracy, and the crucial frameworks have largely been decided. Then there is Mary. She has been invited to take a seat at the table. She has ideas on how to improve her community's access to food, but she hesitates. The room is full of seasoned officials, and her lack of experience in policy discussions keeps her quiet. Across the room is Martha. She arrives confident, eager to share direct insights from her neighborhood. She speaks up. She is politely heard, but she quickly realizes her input is a formality. The real decisions were agreed upon before she even sat down. For decades, large-scale advocacy programs have measured success by participation. We count the number of women placed in a room. But having a seat at the table is completely detached from having the power to actually shape a policy. We operate on a flawed mathematical assumption that visibility and a voice result in influence. They do not. Placing someone in a room full of experienced bureaucrats and handing them a microphone leaves the entrenched governance system undisturbed. Without a change in structural power, the invitation is a performance. If we want marginalized participants to actually wield power, the systemic rewiring cannot start in a state house or a county forum. It has to start at the kitchen table. Before a woman can effectively shape a national nutrition policy, she has to be able to shape the choices made under her own roof. This is the operational premise of the Social Analysis and Action Framework, or SAA, deployed by the CASCADE initiative across local communities in Nigeria and Kenya. The first barrier is entirely psychological. Many women have spent a lifetime internalizing the idea that their voices do not carry weight in financial or dietary decisions. You have to dismantle these learned limitations and systematically build personal agency before anyone steps up to a public microphone. The raw data proves this localized approach works. Across thousands of cohorts, 96% of women involved reported achieving adequate participation in their household's decision-making, specifically directing how income is used and controlling access to physical assets. Once that baseline of agency is established at home, the boundaries expand outward. Women begin facilitating social dialogues that challenge deep-rooted gender norms affecting care work across their wider neighborhoods. Communities introduced highly specific tactical tools, like household commitment cards, to formalize shared responsibilities between partners for maternal and child nutrition. With a stabilized home environment and balanced domestic labor, women have the bandwidth to engage directly in local producer groups and community savings associations. The dialogue across the community shifts. It moves away from passive observation of external problems and toward active collective planning around livelihood resilience and securing healthy diets. This dense network of personal confidence and community backing is a mandatory prerequisite. Without it, stepping into a government policy arena is an unwinnable battle. But even a fiercely organized community will eventually hit a wall. They face an institutional apparatus that was deliberately constructed to govern without their input. To force a breakthrough, the system itself has to be targeted. The CASCADE initiative directed resources at government officials, providing highly technical capacity training focused entirely on gender mainstreaming. State governments in Nigeria, like Bauchi and Nasarawa, served as active testing grounds. Officials were mentored on how to rewrite internal committee selection criteria so that women were guaranteed seats in decision-making spaces. This represents institutional recognition, the point where the state formally integrates these women as essential architects of policy. This chart details the mechanics of recognition. In Kenya, counties integrated gender-responsive interventions into multi-sector nutrition policies. Crucially, these policies were backed by capital, etching dedicated budget lines into county frameworks. Simultaneously, national agri-food plans structurally mandated the inclusive participation of women and youth. This is how you solve the Martha problem. By altering the literal blueprints and financial ledgers, the government ensures that a policy decision simply cannot be finalized until these specific community members are formally consulted. As these legislative gears turn, the abstract language of policy translates into changes at the family level. We see this in highly specific legislative actions, like the institution of formal, funded workplace breastfeeding support programs, operating as direct nutrition interventions. And we see it at the ground level, where expanded access to productive assets and income opportunities directly correlates to an increase in the sustained consumption of nutritious foods by the most vulnerable households. Let's look back at the incomplete math that stalled so many advocacy efforts in the past. Influence is the product of visibility, voice, and formal recognition. True policy advocacy is the exhaustive, granular work of rewiring the entire political apparatus, from the kitchen table all the way up to the state budget, so that when marginalized people finally step up to the microphone to speak, the system is structurally forced to act.